The Senate will come to order. Will the clerk please call the roll?
Bridges. Bridges. Buckner.
Present.
Coleman. Cook. Quorum. Danielson. Donovan. Finberg. Fields. Gardner. Janal. Gonzalez. Gonzalez. Waiting for Gonzalez. Hanson. Heisey. Holbert. Hawkins Lewis. Kirkmeyer. Colker. Lee. Liston. Lundeen. Moreno. Pedersen. Priola.
Excused.
Rankin. Rodriguez. Scott. Scott.
Here.
Simpson. Smallwood. Sonnenberg. Story. Winter. Woodward. Zenzinger. Mr. President,
Here. With 34 present, 0 absent, 1 excused, we have a quorum. Would the good senator from Senate District 10 please lead us in the Pledge of Allegiance?
Thank you, members. Will you please stand and join me in the pledge to our great country? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Approval of the journal. Senator Simpson.
Thank you, Mr. President. I move that the reading of the Journal of Friday, March 26, 2021 be dispensed with and that the journal be approved as corrected by the Secretary.
You have heard the motion. All those in favor say aye. All those opposed, no. The ayes having the motion is adopted. Senate Services.
March 29th, correctly printed Senate Bills 199, correctly engrossed Senate Bill 132, 160, correctly re-engrossed Senate Bill 139, correctly revised House Bill 1054, 1075, and 1137, correctly re-revised House Bill 1126, correctly enrolled Senate Bill 70.
Third reading of bills consent calendar. Will the clerk please read all of the bills listed or the bill listed on the consent calendar?
House Bill 1137 by Representatives Wiseman and Van Winkle and Senators Lee and Gardner concerning notifications by legislative staff to members of the General Assembly regarding rules adopted as a result of legislation.
Members, we are on thirds. Mr. Majority Leader.
Thank you, Mr. President. I move for the passage of the bill on the third reading of Bill's consent calendar, which includes House Bill 1137.
Is there any discussion on House Bill 1137? Seeing none, the motion is the passage of House Bill 1137 on third reading and final passage consent calendar. Are there any no votes? With a vote of 34 ayes, 0 noes, 0 absent, 1 excused, House Bill 1137 is passed. Co-sponsors. Senators Moreno. Third reading of bill's final passage. Will the clerk please read the title to House Bill 1075?
House Bill 1075 by Representatives Lontine and Senators Gonzalez concerning replacing the term illegal alien with worker without authorization as it relates to public contracts for services.
Mr. Majority Leader.
Thank you, Mr. President. I move House Bill 1075 lay over until tomorrow, March 30th.
The motion is to lay over House Bill 1075 until 3/30/21, retain its place on the calendar. All those in favor say aye. All those opposed, no. The ayes have it, and that motion is adopted. Will the clerk please read the title of House Bill 1054? Mr. Majority Leader.
Thank you, Mr. President. I move House Bill 1054 lay over until tomorrow, March 30th.
The motion is to lay over House Bill 1054 until 3/30/21 and retain its place on the calendar. All those in favor say aye. All those opposed, no. The ayes have it, and that motion is adopted. Mr. Majority Leader.
Thank you, Mr. President. I move Senate Bill 160 lay over until tomorrow, March 30th.
The motion is to lay over Senate Bill 160 until 3/30/21 and retain its place on the calendar. All those in favor say aye. All those opposed, no. The ayes have it, and that motion is adopted. Will the clerk please read the title to Senate Bill 132?
Senate Bill 132 by Senators Donovan and Representative Tatone concerning a study of consumer protection regulation of digital communication platforms.
Senator Donovan.
Thank you, Mr. President. Colleagues, I was going to lay this over, but just so that we can do something this morning, I'll go ahead and move the bill on third reading and final passage and ask for your support.
Is there any discussion? Seeing none, the motion before the body is the passage of Senate Bill 132 on third reading and final passage. Are there any no votes? Senators Lundin, Simpson, Heisey, Cook, the Minority Leader, Kirkmeyer, Sonnenberg, Woodward, Rankin, Smallwood, Scott, Liston, Quorum, Gardner. With 20 aye votes, 14 no, with 19 aye votes, 15 no votes, 0 absent, and 1 excused, Senate Bill 132 is passed. Co-sponsors. Mr. Majority Leader.
Thank you, Mr. President. There's been a request to remove Senate Bill 133 from the consent calendar on seconds, and so I move that it be placed to the bottom of the general order second reading of bills calendar.
The motion, Senate Bill 133 as requested will be moved to the end of the general order second reading of bills calendar. Second reading of bills. General orders. Senator Zenzinger.
Thank you, Mr. President. I move that the Senate resolve itself into the Committee of Whole for the consideration of general orders, second reading of bills.
You have heard the motion. All those in favor say aye. All those opposed, no. The ayes having the motion is adopted, and the Senate will resolve itself to the Committee of Whole for consideration of general orders, second reading of bills, and Senator Zenzinger will take the chair.
No, I'm going to lay it over this.
The committee will come to order and the court rule is relaxed. Will the clerk please read the title to Senate Bill 177? Majority Leader Fenberg.
Thank you, Madam Chair. I move Senate Bills 177, 124, and 143 lay over until tomorrow, March 30th.
The motion is to lay over Senate Bill 177, 124, and 143 until tomorrow. All of those in favor say aye. Aye. Those opposed, no. The ayes have it, and the bills will be laid over. Will the clerk please read the title to Senate Bill 147?
Senate Bill 147 by Senators Fields and Holbert and Representatives Frolick and Van Winkle concerning the continuation of regulation of athletic trainers by the Department of Regulatory Agencies.
Senator Holbert.
Thank you, Madam Chair. I move Senate Bill 147.
To the bill.
Thank you, Madam Chair. In committee, we had great discussion about continuing the regulation of athletic trainers. Want to give a shout out to the one and only John Elway for joining us for that committee hearing. The former quarterback of the Super Bowl champion Denver Broncos made it clear that athletic trainers had played a key role in his athletic career, all the way from Pop Warner football through winning the Super Bowl and now leading what I still believe to be the best team in the NFL. Athletic trainers in Colorado provide frontline assistance, especially in children's sports and high school sports. An athlete might have an injury, broken bone, for instance. The EMTs might be there at the field. They might be on call. We did hear from the good senator from Alamosa that in some cases, the ambulance crew, the EMT, might be there at the game and then get called away because there aren't multiple of those in some rural counties. They might get called away for a car accident or a heart attack or something else, and then a student has an injury. And in those cases, here in this state of Colorado, athletic trainers are there, or an athletic trainer hopefully will be there on the sidelines, and they provide that emergency first response. This is a great reason why athletic trainers should continue to be regulated in the state of Colorado. Ordinarily, I would jump at the chance to sunset, to get rid of. But there are 49 states that regulate, license, or register athletic trainers. There's one, apparently, that does not. That state is California, and we heard in testimony in the hearing that there are some issues in California that sometimes forms of abuse are discovered. We are not asking you to support Senate Bill, or I am not asking you to support Senate Bill 147. I wouldn't presume to speak for the good senator from Aurora. I'm asking you to support it not because we need to clean up the industry, but because I very much want to continue the excellence of the industry. It isn't that there's been a huge number of consumer complaints, it's the fact that there haven't been. And because these folks provide such great care for kids and adults in especially rural parts of Colorado, but throughout our state, and they are asking for this to continue as well. Madam Chair, I do have an amendment, but I want to give the good senator from Aurora the opportunity to speak to 147 before we move on to that.
Senator Fields.
Thank you, Madam Chair, and thank you, Minority Leader. I think I'm going to save my remarks to addressing the bill because we do have a two-page amendment that I would like for him to address because it was something that has a little history to it, and I'm quite sure he'll describe it a lot better than I could.
There is an amendment on the desk. Will the clerk please read Amendment L004?
Amendment L004 to Senate Bill 147.
Senator Holbert.
Thank you, Madam Chair. I move L004.
To the amendment.
Thank you, Madam Chair. L004 is a multi-page amendment. One reason that we have a multi-page amendment, and we have copies here if you'd like to come see it, there was agreement going into committee between the folks representing athletic trainers and the folks at DORA and the Department of Law that they, especially DORA and the Department of Law, be given time to review those amendments, I think even though they asked for them. We were happy to do that. So we're bringing, instead of three separate amendments, bringing one multi-page amendment. And the basis, the core ask in this amendment is that we designate the names, the job titles of the people who athletic trainers work under delegated authority. So you'll see repeated reference to physician assistant license under this article. There is an attempt here in Colorado to not only, or I shouldn't say attempt, but there needs to be clarity in this amendment that the athletic trainers don't always work directly under the delegated authority of a physician, but also a physician's assistant, and that has to be repeated in multiple places. And that's the basis of L004. Happy to try to answer any other questions, but I do want to say thank you to everyone, all the stakeholders on Senate Bill 147, and to our good friend Michael Nicoletti at DORA, and to our good friend Kurt Morrison at the Department of Law, who both contributed to making sure that this amendment works. I'm aware of no opposition and ask for an aye vote on L004.
Is there any discussion on Amendment L004? All right, seeing none, the motion is for the adoption of Amendment L004. All those in favor say aye. Aye. Those opposed, no. The ayes have it, and the amendment is adopted. Senator Fields.
Thank you, Madam Chair. To the bill, members. Senate Bill 21-147 is good public policy for the state of Colorado. And the reason I say so is because of the collaboration that you just heard the minority leader talk about as it relates to making sure that we were gathering together the right stakeholders to make sure that we do it right. When DORA presented us with the sunset, they wanted to eliminate the practice. They wanted to wind it down, which means that it would have been repealed on September the 1st of 2021. But we heard from so many people that really rely on athletic trainers. It could be at a hockey field. It could be at a soccer field. It could be at a high school football field. It could be at a volleyball tournament. But the role they play, and we also heard from the NFL, we did have John Elway in our committee, that they're there to safeguard players. Because you just never know the impact of a specific injury. And so what an athletic trainer will do will quickly assess what's going on and take the appropriate actions to move forward. So I'm not quite sure why in the state of Colorado we would want to repeal this practice when we're talking about young kids who might be doing ice skating or baseball or what have you. We need to have this type of medical professional on the field because you just never know when an accident might take place and their physical health needs to be examined. So this bill will continue that practice for the state of Colorado through September the 1st, 2031. So members, I urge a yes vote on Senate Bill 147.
Is there any further discussion? Seeing none, the motion before the body is the adoption of Senate Bill 147. All of those in favor say aye. Those opposed, no. The ayes have it, and the bill is adopted. Will the clerk please read the title to Senate Bill 142?
Senate Bill 142 by Senators Pedersen and Donovan, Representatives Caraveo and McCluskey concerning removing certain restrictions related to abortion services and in connection therewith, removing the requirement that the services be performed only at certain health care facilities and removing the requirement that only a physician perform the service.
Senator Pedersen.
Thank you, Madam Chair. I move Senate Bill 142 and the Health Committee report.
To the Health and Human Services Committee report.
Thank you, Madam Chair. We added some additional clarifying language around what providers qualify in this bill, and I ask for your support.
Is there any discussion on the committee report? Seeing none, the motion is the adoption of the Health and Human Services Committee report. All those in favor say aye. Those opposed, no. The ayes have it, and the report is adopted. To the bill, Senator Pedersen.
Thank you, Madam Chair. Members, this bill comes out of decades-long policies that have passed first at the ballot and then here in the legislature. In, I believe it was 1989, Colorado passed a ballot measure to say that no public funding will be used for abortions. Then the Hyde Amendment was passed at the federal level to say that you have to leave exceptions for cases of rape and incest. So Colorado then came back and said, all right, Well, if we have to have this exception, we're going to make it as difficult as possible for sexual assault survivors, making it so that only one place in Colorado actually qualifies for reimbursement. Now, the problem with this is that people in Colorado live, across the state. They don't live right next to this one hospital. It creates unnecessary barriers for people in one of the most difficult situations. Our sexual assault survivors. If you have been raped by your father, these people who qualify for Medicaid, who make $17,000 or less, are then trying to figure out how they're going to cross mountain ranges in order to get to the place that will actually give them the care that they need. This is just addressing a very outdated policy here that was put in place to restrict access, to make it as difficult as possible. And so we are going to remove these barriers to ensure that in this terrible situation, this very narrow scope, as you can see with the fiscal note, it doesn't even address increase in costs because this is such a limited situation, that we are giving access to abortion in the same places by the same people that every other person in Colorado has access to under insurance. And I ask for your support.
There is an amendment on the desk. Will the clerk please read Amendment L005?
Amendment L005 to Senate Bill 142. Amend the Health and Human Services Committee report.
Senator Smallwood.
Thank you, Madam Chair, and appreciate the preamble that we heard from the Senator from Lakewood on this bill. The committee report that was referenced, for those of us who are on the Health and Human Services Committee, the committee report is a little bit more significant than what I feel you might have heard. So this bill is a short bill. If you have a chance to look at it, it's only a couple pages. And I think the bill sponsor's accurate in saying that previous statute was fairly restrictive on where women in our state could receive abortions and who could perform those abortions. And I understand the proponent's desire to look to perhaps expand that. But I think for any of us who are concerned about the safety of these patients, the safety of women seeking abortions, I feel needs to be pretty high on the list here of what we do. So what this bill did as introduced, and again, it's only 3 pages, easy to read. It basically said that a woman in our state could get an abortion from anyone, anywhere.
Senator Smallwood, I don't think you actually moved your amendment.
Thank you. Thank you, Madam Chair. I move Amendment L005.
Great, thank you very much. You may proceed.
Thank you very much, Madam Chair. Thanks for catching that. So the introduced bill said that women in our state can get abortions from anyone, anywhere, as long as they hold a license. So that license could be in audiology, it could soon be an athletic trainer, it could be a landscape architect, it can be anyone with a license, according to statute. And it removed the restriction that abortion should be performed in where we know is safe, a licensed healthcare facility. So I very much appreciate the bill sponsors accepting a few amendments that I suggested in committee, perhaps the only 2 amendments I've ever suggested in committee that the sponsors have adopted. And you'll see in the committee report, one of them is, if you look on lines 4 through 6, 7 through 8, says, okay, we didn't necessarily mean that anyone in our state with any license could perform an abortion. And the sponsors mercifully were willing to say, why don't we instead limit this to somebody in our state with a license and acting within the scope of that provider's license and in accordance with applicable federal restrictions, which I think was a very common sense amendment. And again, I'm very appreciative that the members accepted that. So now the bill, as amended, says that at least somebody who it's in their scope of practice is able to perform these abortions. But what we weren't able to get quite accomplished in committee, and there was, I think, robust conversation around it, was now, where do we want to tell these physicians it is illegal or illegal to perform these abortions? So what we've heard is a licensed healthcare facility, some folks feel is too restrictive. Candidly, I don't feel is too restrictive. I think that protects the safety of women patients in our state. But if that's the case, to say that, to take it all the way to the other extreme and say abortions can be performed anywhere. They can be performed in parks. They can be performed in people's garages. They can be performed literally anywhere. I think that's taking things a little bit too far. So all I'm asking is that we consider Amendment L005, which states that other than for the administration of abortifacients, which I understand this is kind of perhaps the driving motivator for some folks supporting this bill, is that they didn't want abortifacients to be restricted to licensed healthcare facilities. So you can see we put in an exception for that somebody could be dispensed medication, for example, that they could take home. But outside of those, we would want abortions, when performed, to be in a healthcare facility licensed pursuant to Section 25-3-101, which we went through in detail in committee. It's more than just hospitals. And within the scope of the provider's license and in accordance with applicable federal regulations. So again, keeping in mind that the safety of our patients is as important as access and affordability, I'd ask for an aye vote on Amendment L005. Thank you, Madam Chair.
Is there any further discussion on Amendment L005? Senator Pedersen.
Thank you, Madam Chair. And, this continues to bring some confusion around what we're doing and why we should not be calling out facilities, because licensed facilities are the examples that we have of things that are licensed for facilities include things like general hospitals, hospital units, psychiatric hospitals, community clinics, rehabilitation hospitals, community mental health centers. All of these are ones where you actually have an inpatient process. They have a standard for how many bathrooms, for example, it has. There is no such thing as unlicensed facilities. We license providers. And for example, Davis, when I bring him into his pediatrician, the pediatrician is licensed by the medical board and operates under the full laws, rules, and regulations of the State Board of Health. The Health Code, Medical Ethics Board, guidelines by the American Academy of Pediatrics. But the pediatrician's office, as a normal outpatient medical office, is not a licensed building facility. 99.8 to 99.1% of abortions in our state do not occur in a hospital. This is not a surgery, it is an outpatient service. So unfortunately, tactics like this have been used across the country to limit access to abortion care by trying to regulate facilities and calling them out specifically around this specific type of care. So what this is saying, what this amendment would do, is it would continue to restrict access for people who have gone through, who have gone through sexual abuse, who unfortunately have been raped, who make very little money, have very little resources. It would continue these barriers. And so I ask for a no vote. This is not, in Colorado, you can't currently, we don't regulate, a provider who is certified, who has to meet all of the standards that I laid out, is not going to go to a park because then they would lose their license. So that would not, they would be breaking the law. So there is no reason that we should be calling out facilities, and that would actually, unfortunately, take us backwards with what we're trying to do in this bill.
Senator Smallwood.
Thank you, Madam Chair, and thank you to the senator from Jefferson County for her opinion on that. But what's frustrating is what we tried to get to at committee was where the gray area in this is. Meaning, I don't believe that any of us are comfortable even anecdotally hinting to physicians that performing abortions in some place that's not clean, that's not sanitary, that's not safe is the intent of this bill. So understand today we feel far too restrictive. Licensed facility, not enough choices for women seeking these procedures. But colleagues, this bill now says you can literally have an abortion anywhere. Anywhere. And we're going to rely on physicians' judgments in order to protect the safety of these patients. And colleagues, we've all seen what happens when we are not crystal clear in legislation and where, somebody had to graduate last in medical school. Is this really the message that we want to send to these providers? So what I'm trying to do is offer some gray area in this. If we feel that what you heard, community clinics and that type of thing, is still too restrictive, I would love to hear from the sponsor what types of facilities or even locations, what types of locations would be acceptable to the proponents of this bill so that we can add it into statute. I have no doubt that this bill is going to pass the Senate. You've got half of the Senate already listed as co-prime sponsors. All we're asking is a little bit of clarification. Facilities is too much. Okay, great. Where do we want to tell these providers that we feel is safe, secure environment for these patients? And that's the amendment that we'll put together. I'm happy to do it. I'd ask for an aye vote on Amendment 5.
The motion before the body is the adoption of Amendment L005. All those in favor say aye. Those opposed, no. The noes have it, and the amendment is lost. There is an amendment on the desk. Will the clerk please read Amendment L006?
Amendment L006.
Senator Smallwood.
Thank you, Madam Chair. This time I'll move Amendment 6.
Great, thank you.
So, colleagues, I feel like the questions that I'm asking are reasonable.
Did you actually move it, though? You said you were going to, but did you? Can you say the words, I move?
Touche, Madam Chair, touche. I move Amendment 6.
Great, thank you.
It's Monday. I'm frustrated by lack of cooperation on these amendments.
Noted.
So with Amendment 6, very much like Amendments 7, 8, 9, 10, 11, and 12, I guess I will try to offer perhaps suggestions that the proponents might feel are acceptable of an ever-growing list of places that we feel as a body are safe, sterile environments for women to receive abortions in our states. So let's start with one that I feel is the most obvious. In addition to facilities, which the good senator from Jefferson County already read through the list, and if it's true that 99% of abortions in our state are not performed in these facilities, why don't we add a physician's office? Since we have already said, it was already accepted in committee, that just anyone performing abortions in our state, landscape architects, audiologists, is not acceptable. How about now we look at a facility, a healthcare facility, or a doctor's office? And we'll continue making these incremental steps, continue adding more locations until we as a body feel that we have given proper guidance to the medical profession of places that they can and cannot perform abortions in our state. Now we've got facilities, and literally, colleagues, every doctor's office in the state of Colorado is now included. So hopefully this one's reasonable. I'd ask for an aye vote on Amendment 6.
Senator Donovan.
Thank you, Madam Chair. I mean, as my good colleague and I know, because we talk about healthcare quite a bit, it's a pretty messed up hobby that him and I have. But healthcare is already one of our most highly regulated, licensed, controlled, ethical expectations venue that we have. So while I appreciate maybe the intent of these amendments from the senator from Douglas County, what the language would actually do is move us in the opposite direction of where the bill is going. I mean, if some of the suggestions happened that were that are being made as possible arguments for why to not support these amendments or bills, if any of those things actually happened, the provider would lose their license. I mean, it's the exact same regulatory framework that we exist under right now, where we expect medical providers to exist under the scope of their practice. That we don't need to address that bill. That's already the expectation of practicing healthcare in our state. So I ask for a no vote on Amendment 6.
Senator Pedersen.
Thank you, Madam Chair. And just to add, we don't even have a statutory definition of a doctor's office. As you just heard, healthcare is already regulated. It already requires that you comply with federal or state law. And if you don't, you'll be charged with malpractice. And so this amendment would not, ultimately, we wouldn't be able to tie it to what a definition of a doctor's office is. And I ask for a no vote.
Senator Smallwood.
Thank you, Madam Chair. Thank you to my colleagues from Vail and Jefferson County for their opinions on this. Colleagues, I think this is reckless. I think it's absolutely reckless. We have so many examples just in the last several years of healthcare providers acting poorly. You don't need me to stand up here and start listing the Larry Nassers of the world, who we've said, well, they're a professional, so therefore let's give them latitude. We know that they're going to act judiciously, I'm sure. Otherwise, their license is at risk. We're really comfortable passing a bill without any restrictions whatsoever on the location that a physician can perform an abortion in our state. Literally no restriction. This can be done anywhere, and we're going to rely on the healthcare providers themselves acting within their license. We do not think that it's responsible or necessary as a body to simply list the places. We all know it, colleagues. We all know the places. There's a finite list, and guess what? It doesn't include parking garages or people's basements. Yet we're willing to pass this without any limitations at all. Colleagues, I can't tell you how disappointed I am in this. Thank you, Madam Chair.
Seeing no further discussion, the motion before the body is the adoption of Amendment L006. All those in favor say aye. Those opposed, no. The noes have it, and the amendment is lost. Seeing no further discussion, the motion before the body is the adoption of Senate Bill 142. All of those in favor say aye. Those opposed, no. The ayes have it, and the bill is adopted. Will the clerk please read the title to Senate Bill 152?
Senate Bill 152 by Senator Lee and Gardner, Representative Harrod and Soper, concerning implementation of the Committee on Legal Services recommendations in connection with legislative review of state agencies' rules.
Senator Lee.
Thank you. Thank you, Madam Chair. It's my pleasure, colleagues, with my colleague Senator Gardner, to bring the Rules Bill, an annual bill that we bring to the legislature, which enacts all of the rules by the agencies that were adopted pursuant to the marvelous bills and legislation that you all have passed. It came out of the Committee on Legal Services with a unanimous vote, and we urge your support for this marvelous bill.
Senator Gardner.
Thank you. As many of you know, sometimes the rule bill can be controversial. It is not this year. And the sooner we move it on, the less likely it is to become controversial. So I urge an aye vote and appreciate all of the hard work that has been done by the staff and the Office of Legislative Legal Services to bring this bill to this point. Thank you.
The motion is the adoption of Senate Bill 152. Oh, so can you come back and move the bill before we vote on it?
I move Senate Bill 152 and ask for an aye vote.
Thank you. All those in favor say aye. Aye. Those opposed, no. The ayes have it and the bill is adopted. Will the clerk please read the title to Senate Bill 133?
Senate Bill 133 by Senators Quorum and Representatives Caitlin, concerning alcoholic beverages donated for the purpose of a special event held at a club licensed to sell alcoholic beverages to the drink to club members within consumption of club premises.
Senator Quorum.
Thank you, Madam Chair. I move Senate Bill 133. This is something that has gone on in the service communities. I mean the clubs, Elks Lodges, Moose, VFW, all these organizations. In rural Colorado, many times, the only building long enough to hold an event is one of these service organizations. So they apply for a special license. And what happens? They buy their special license, they come from a licensed dealer, and they put the stuff out, but they can't put it out the day of the event. It has to go in Closet B. Cannot be brought out until the special event. The stuff that's on the shelf right now has to go in Closet A. You cannot commingle. The taxes are paid, and it doesn't make any sense to me that you cannot take a product. Let's take your favorite alcohol that you drink, and it's purchased, the taxes are paid, it's to be used for the special license, and not all of it's consumed. So rather than leaving it out for the organization to go ahead and dispense from, it's taken back and putting in a special closet because of that license. We had, this doesn't affect a lot, about a little over 300 lodges and organizations, but it doesn't make any sense to me at all. It's kind of like, I see the good senator from Northeast Colorado just came by. We send a lot of water over the Trans Mountain diversions. We don't ask that it not be commingled. Doesn't make sense. Ask for an aye vote.
Is there any further discussion? Seeing none, the motion before the body is the adoption of Senate Bill 133. All those in favor say aye. Those opposed, no. The ayes have it, and the bill is adopted. Majority Leader Fenberg.
Thank you, Madam Chair. I move the committee rise and report.
The motion before the body is to rise and report. All those in favor say aye. Those opposed, no. The ayes have it, and we will rise and report.
We don't have anyone here. Yeah, that's what I figured. You okay? Did I do something wrong? Oh, yeah. They are.
Senate will come to order. Senator Zenzinger.
Thank you, Mr. President. The committee has met and had a number of bills under consideration. Will the clerk please read the report?
Mr. President, your committee of the whole begs leave to report has had under consideration the following bills, being the second reading thereof, and makes the following recommendations thereon. Senate Bill 147 as amended, Senate Bill 142 as amended, Senate Bill 152, Senate Bill 133 passed on second reading, ordering, gross, and placed on the calendar for third reading and final passage. Senate Bill 177, 124, and 143 laid over until March 30th and retain their place on the calendar.
Senator Zenzinger.
Thank you, Mr. President. I move the report.
Motion is for the adoption of the committee of the whole report. Are there any no votes? With a vote of 34 ayes, 0 noes, 0 absent, 1 excused, the committee of the whole report is adopted. Senate Bill 147 as amended, Senate Bill 142 as amended, Senate Bill 152, Senate Bill 133 passed on second reading. And ordering, gross, and placed on the calendar for third reading and final passage, Senate Bill 177, Senate Bill 124, Senate Bill 143 laid over until 3/30/21, retaining its place on the calendar. Senator Donovan.
Thank you, Mr. President. Having voted on the prevailing side, I move for the immediate reconsideration of Senate Bill 132.
The motion is for the immediate reconsideration of Senate Bill 132. All those in favor say aye.
Aye.
All those opposed, no. The ayes have it, and the motion is adopted, and reconsideration is granted. Senator Donovan.
Thank you, Mr. President. I move Senate Bill 132 on third reading and final passage and ask for your aye vote.
Will the clerk please read the title to Senate Bill 132?
Senate Bill 132 by Senators Donovan and Representative Tatone concerning study of consumer protection regulation of digital communication platforms.
Senator Donovan.
Thank you, Mr. President. I move Senate Bill 132 on third reading and final passage and ask for an aye vote.
The motion is the passage of Senate Bill 132 on third reading and final passage. Are there any no votes? Senators Cook, Lundin, Sonnenberg, Gardner, Minority Leader, Kirkmeyer.
Yep.
Senator Sonnenberg, I have you recorded. Simpson, Heisey, Scott, Liston, Quorum, Rankin, Smallwood.
We recorded everyone.
With 20.
Sorry. What now?
Senator Lundin, I have you recorded as a no vote.
We've got someone coming back into the room. Thank you. Sorry. It was. Yes.
There he is.
No votes on Senate Bill 132.
There we go.
Woodward. With 20 aye votes, 14 no votes, 0 absent, 1 excused, Senate Bill 132 is passed. Co-sponsors. Senators Moreno, Bridges, Gonzalez. Please add the president. Signing of bills.
March 29th, the President has signed Senate Bill 24.
Announcements. Mr. Minority Leader.
Thank you, Mr. President. Mr. President, because we have already had a moment of silence and had the chimes ring, because we have acknowledged Officer Talley's death already, Mr. President, I don't know that it would be appropriate to do that again, but members, I had the opportunity during second reading to go over to my office. I have a window that faces Colfax, and the procession for Officer Talley just passed by the Capitol going over to the cathedral. Please be aware that service is going on just down the street, and let us keep the Talley family, their friends, the other officers of the Boulder Police Department in our prayers. Again, Mr. President, if you think it's appropriate that we have another moment of silence, I would certainly acknowledge that, but we've done that before. Just wanted everybody aware that family, friends, and other law enforcement officers that cared about Officer Talley and are attending that service are in our neighborhood here, Mr. President.
The Senate will stand in a moment of silence. Announcements. Senator Quorum.
Thank you, Mr. President. I would ask for a moment of personal privilege.
Granted.
Thank you, Mr. President. You know, last week was a tough week in Colorado. We all acknowledge that. And it wasn't just in Boulder. Last week, last Saturday, an auto accident occurred in my district, and the chief of the Natarita Nuclear Fire Department was the first on the scene to a rollover down the hill. Chester Riley was the first there. He walked down the hill to check on injuries, walked back up the hill when others arrived, walked back down the hill to provide assistance once again, walked back to the top of the hill and collapsed from a massive heart attack. We don't think about the risk that our first responders are given. And frankly, we don't acknowledge everything they do, whether they be law enforcement, EMT, fire department. But we really do need to stop and honor these people who give their all. Chester died doing what he loved to do. He served the people of this small community.
Supreme Court. So just be aware of that. Thank you, friends.
Senator Lee.
Thank you, Mr. President. The Ag Committee has graciously given up their committee room, which I think is 354, to the Senate Judiciary Committee, which will be meeting in that Senate committee room now rather than the Supreme Court for all future meetings. Thank you.